Hi, my name is Dr. Ross Hauser. Welcome to the Florida Clinic of Caring Medical Regenerative Medicine Clinics. One of the most common conditions that we see in the office here is migraine headaches. Another common condition that we see is occipital neuralgia. Most people don't realize that both of those conditions are almost always caused by upper cervical instability when there's a structural cause. So I just want to show the anatomy. Most people are familiar with that you have the occiput, it sits on the atlas, which sits on the axis. So occiput, atlas is C1, axis is C2. Now the facet joint, this is the facet joint of C1, C2. What you see is on the back of the facet joint, there's a nerve that runs right behind the facet joint here, which is the C2 nerve root. So if a person has upper cervical instability at C1, C2, see how the C1 vertebrae can hit the C2 nerve root. The occipital nerve is an offshoot, is an extension of the C2 nerve. So the cause of occipital neuralgia, or the trigger of the structural cause of migraine headaches, is instability of the C1, C2 facet joint. The way we document upper cervical instability in our offices is by digital motion x-ray. So I'm just going to show a digital motion x-ray of one of our patients who has been successfully treated for occipital neuralgia. To see the C1, C2 facet joint, the x-ray beam has to go through the mouth, and then what we're looking for is there overhang of the C1, C2 vertebrae when the person bends their head to the side. So if we could run this, and you're going to see that both on the right side and the left side, see how there's overhang here, and you'll especially see it on the other side. And if we could stop it now. See right here, so if we take the end of C1 and then here's the end of C2, it's that space right there, that's the amount of overhang. So the structural cause of migraine headaches and occipital neuralgia is this. It's actually looseness of the facet joint of C1, C2. The treatment of that is prolotherapy, because prolotherapy can tighten the ligaments that surround the C1, C2 facet joint and resolve upper cervical instability. Normally it takes anywhere from 4 or 5 sessions of prolotherapy, and the treatment is extremely successful for resolving migraine headaches and occipital neuralgia.